Welcome. I'm Catherine McDermott. I'm a psychiatric mental health nurse practitioner. Many of you know me here. I'm also the co-owner here at Town Square University Parkway. Today's topic is stages of dementia. And I always find this a very interesting talk because I find that people very often come to me with their loved one who has cognitive impairment and they really don't have any idea what stage their loved one is in. And so it's always very helpful to go through those stages. And I oftentimes get that real kind of aha moment sort of look from families as they realize sort of where their loved one is in the stage of the disease. So on that note, let's see if I can't figure out how to make this thing work. All right. So stage one is actually our baseline. Stage one is our normal aging, right? We all go through memory loss as we get older, right? And I tell people all the time, there's nothing on our bodies that stays the same every day, every year. Everything changes, right? We age. All of the systems in our body age, right? Our musculoskeletal system changes. We have aches and pains that we didn't have when we were younger, right? And we can see some of those changes. We get wrinkles on our face as we get older, right? Some of these things we don't see. And one of the things that we don't see is the changes that happen to our brain. Our ability to process information, both visually, auditorily, our ability to sequence, to do executive function, which is multiple complex tasks, it changes. I know that I do things very differently at the age I am now than I did 20 years ago. We all are going to decline. We're all going to be able to learn new ways to help us remember things, develop strategies that work for us. That's normal aging, right? Most of us will live and die at home, right? There's lots of assisted living facilities, lots of skilled nursing facilities, but the majority of people live in their own home and will age appropriately in their own home, okay? Most of us will never require care or assistance. Dementia is a disease of the aging. It is not normal aging. So if you have a 95-year-old who's sharp as a tack, there's a lot of those. Now, she's probably not as sharp as she was when she was 60, but she's functioning really well for a 95-year-old. Okay, so does that make sense, what normal aging is? Stage two is where we really start to get into cognitive loss. And before we get to the word dementia, we'll talk about mild cognitive impairment. And mild cognitive impairment typically happens in the 60s, the 70s, even in the 80s, where people begin to notice that it's more than just normal aging. They've developed compensatory strategies. They make lists for themselves, and they still can't remember things. They used to be able to work on a computer, which takes a lot of complex processing. And now all of a sudden they can't manage to figure out why this window's open and that window's not open, and how did they get to where they're at, right? And that to the point that they're no longer able to do some of the things that they used to be able to do. This is a very sticky stage for people, right? This is the stage where people say, I'm not so sure that there's something wrong, but I'm starting to notice that there's something wrong and it makes me a little bit nervous. So I'm going to use humor and I'm going to use deflection, and I'm going to say to my wife, gee, I've done the bills for 30 years. It's your turn to do the bills, right? Not going to say to her, hey, I'm having a hard time figuring out how to balance the checkbook or to get into the banking website. And so a lot of times spouses and children and family members, they don't see the mild cognitive impairment because it's happening to that person. That person is being able to develop strategies that help them get through that time, right? But it's not really apparent to anybody else. And they're very much not forthcoming with the fact that they're having the problem because it scares them, right? All right, so it's dismissed by the person with the disease, right? They're not even going to acknowledge that this is an issue at this point. All right, let's talk about the word dementia. And I've talked about this before, but I'm going to go over it one more time. Dementia is the broad umbrella term, right? So dementia simply means that you no longer have the cognitive ability to function independently. So a lot of times when I meet people and they say, well, my mom doesn't have a diagnosis of dementia. And I say, well, who pays your bills? And they go, well, I do. And who does your grocery shopping? Well, my dad does all the grocery shopping and he has to cook and do the laundry too. And would she get lost trying to find her way back home? Oh yeah, she'd get lost. Guess what? Your mom's got dementia. She would not be able to live independently without significant assistance. Okay, that's the definition of dementia. Then we get into the different types of dementia, which is a whole different talk, right? And I've done that one before, the 9 most common dementias, and we'll talk about all of those. But it's important for us to understand what the definition of dementia is, because when we get to stage 3, we now have dementia, right? We now have the inability to take care of ourselves without supports. And this is oftentimes where the kids have a hard time, because mom and dad are living together, and mom and dad are kind of covering for each other to some degree, right? Mom's doing a lot of things for dad, but she's not really telling the kids that dad can't do this anymore. Or she's minimizing how much dad can't do, because one, she doesn't want to acknowledge it, or two, she doesn't really understand why he's not doing these things. They seem to fight all of a sudden more because he won't take a shower and he won't change his clothes and he won't do all the things he used to do. And she doesn't really understand that he's not doing those things because he's declining cognitive. So this is where then we have a spouse pass away and the kids are like, wow, mom really declined since dad passed away. And it's, did mom really decline, or did we not really know where mom was in her level of cognitive impairment? Okay. So stage 3 is where we start seeing those subtle early signs of dementia. And this is where the medications were intended to be started. So this is where you'll see people go to the neurologist and have the scan that shows volume loss, or the amyloid PET scan that shows the amyloid plaques are beginning to form in the brain, and they'll get the diagnosis. Your mom's got Alzheimer's dementia, and the neurologist will say, here's donepezil and memantine. These will help slow the progression of the disease. This is when these meds are initiated and started, right? The problem that we found here at Town Square is that oftentimes that's the end of the education for the family, right? They get given the medication, they get told the diagnosis, they say, stop the receptionist on your way out, make an appointment in 6 months. And the family goes, what? Like, what am I supposed to do with this diagnosis? What happens next? What's going to happen to my loved one? And that's where we here at Town Square have really tried to help you folks understand what's going to happen next and how the disease is going to progress. Because dementia is considered a progressive terminal neurologic disorder. It will take people sooner, right? We're all dying, right? None of us are getting out of here alive. But with dementia, you're going to die faster because your brain is going to resorb. It's going to become smaller and smaller. And as we get through the stages, you're going to see all of the things that you're not going to be able to do anymore for yourself. Does that make sense? Okay. So that's stage 3. All right, stage 4. So stage 4 is, if you think stage 3 was sticky, stage 4 is even stickier. Stage 4 is where the person with dementia knows that there is something wrong, and sometimes they can't acknowledge that there's something wrong. Now, there's a difference between can't and won't, right? I can't acknowledge that something is wrong with me because my brain is broken. I won't acknowledge something's wrong with me because I have the ability to process that information, but I'm in denial and I don't believe that it's happening to me. A little bit of a crossover. I can't say that it's all of one or all of the other. I mean, sometimes we have very stubborn people, have always been stubborn in their life, and they're not going to believe that something is happening to them. But it's also that their brain is not able to process that complex concept because their brain doesn't work. So I tell people it's like asking the paralyzed man to get up and walk across the room. Would any of you ever do that? Would you walk up to a man in a wheelchair and say, can you get up and walk across the room? No, because you can see that that person can't do that. We can't see that our loved ones with dementia brain isn't working. We can't see that they can't process that information. And it seems so reasonable, right? To be able to say, like, well, why aren't you doing this anymore? Or what's going on? Or why are you acting this way? And expect them to be able to tell us the answer to that question. But they can't because their brain's not working. So in stage 4 is when we oftentimes start to see a lot of the butting of the heads and the beginning of behaviors, because they just can't wrap their brain literally around the fact that something is going on with them. And this is where the agitation happens, because we as families reorient. What do you mean you think it's Tuesday? It's Wednesday. How come you don't know it's Tuesday? Or how come you don't know it's Wednesday? And they get upset. Well, of course I knew it was Wednesday. And then they get defensive with you, and then you wind up getting into arguments, or they empty the dishwasher and they put things places you've never seen them put them before. We've always put the colander over there. We've never put the colander over there, right? And so this is where things begin to get, difficult, especially with spouses, because the behaviors are changing and we don't understand why they're changing. And the person with dementia doesn't understand why they're doing what they're doing. And so they're feeling anxious. And so they get defensive, they get agitated when we try to redirect them. And then many times I have families that, really want to, they say, well, I just want to teach him what he's doing wrong. Well, his brain is broken. He can't learn anymore, right? So all of our lives we teach, right? We teach our children, we teach other people in our jobs, we teach colleagues and coworkers how to do things. It's natural as a human being to show other people things that you know how to do. It feels natural when your loved one is having difficulty doing something or processing information to try to teach them how to do it again. But they're not teachable at that stage. And they get agitated because you're asking them to do something that is beyond their capability. You wouldn't sit a 5-year-old down and give them a physics problem and try to teach them how to do it, because they can't. But that's what we do to the person with dementia when we try to teach them or reason with them about things that they can't learn or be reasoned with. And this happens a lot in stage 4. I was just seeing a patient just now, and the wife told me that her husband's very social. And so they were sitting at a restaurant having dinner, and a gentleman came in with a Boston Red Sox t-shirt on. And so he got up from his table and went over to their table and had a conversation with him about the Boston Red Sox. Now, he's a friendly guy, but he's lacking one thing. What's he lacking? Social skills, right? Social skills. It's inappropriate to walk up to a couple in a restaurant that's sitting and having dinner by themselves and insert yourself into the conversation and want to talk to them about Boston because they're wearing a Boston Red Sox shirt. This is a very common thing that happens in stage 4. They lose that filter, they lose those social skills, and they begin to do things that, yeah, they were always friendly, and if the guy was walking in the park, he might have stopped him and talked to him about Boston because he was wearing a t-shirt. That would be appropriate, right? But to get up and walk all the way across the restaurant and stand at this man's table while he was having dinner with his wife is not socially appropriate. And that's the little nuances that begin to happen, and we're like, why is he doing this, right? I had a patient yesterday, his wife told me that he likes to tell everybody he's a millionaire. Well, he's 80 years old. He's amassed worth. He's got a nice financial portfolio. I mean, they're not multi-millionaires. I mean, they're not living high on the hog. They have money. But it's not normal socially to meet people and shake their hand and say, hey, I've got $1 million in the bank. Like, who does this? People with dementia. Because they lose that filter. They lose that ability to recognize those social skills. The other thing that happens in stage 4 is they become very susceptible to scams because they believe things that there's no evidence to believe. They get a postcard in the mail. They've won a cruise. Well, did you really win a cruise? Because you got to pay $250 and you have to sign up for, a day for the time-shared talk. And, did you really win a cruise? But they really believe that. Or they get those phone calls that come in on our scams. This is the Social Security office, and I need your Social Security number, and you have to pay $1,000 or your account's going to get closed or whatever, and they fall for it right away, right? So those insight and judgment pieces become very difficult. This is where I see families will have a loved one who always did stock portfolio, and now all of a sudden the money's gone because nobody was really watching. Were they making good decisions with the money, right? Because dad always did the money, so nobody thought to ask. That's where stage 4 is really sticky. We have a lot of people at Town Square who are stage 4. They think they work here. Some of them actually do, in terms of like doing things for us and sort of volunteering their time. And we try to give them that respect and that feeling of accomplishment, because that's something that they're missing. That's something that's being taken away from them every day as the disease is progressing. Not that we want to take those things away from them, but as the disease progresses, they're unable to do certain things for themselves, right? And so we have to do those things for them. And that's where the Montessori sort of programming that we do here, where we try to evaluate each person, determine what they're still able to do, and then sort of build on those skills so that they feel like they're still able to accomplish something. All of us as human beings wake up every day and want to go out and have some sort of positive impact on society. No matter what it is, we want to accomplish something every day. And as your dementia progresses, those are things that are harder and harder for you to be able to do, because they require that executive function, that ability to complete complex tasks. And so we really want the members here to feel that sense of accomplishment in stage 4. And when we do that, then they're more willing to come. If they feel like we're babying them, or they're doing things that are, not, what am I doing that for? We can't explain neuroplasticity and cognitive stimulation to somebody with dementia, right? So we just have to make it interesting for them and make them feel like they're a part of something that they can be proud of, that they're accomplishing something. A lot of times the medical system has failed us at this stage, because the husband and wife go in for the visit, and the wife wants to talk to the provider, whether it's the neurologist or the primary care, to mention some of these things that are going on. And yet the primary care has 15 minutes. You get 5 minutes with the nurse, and then you get maybe 15 minutes with the doctor, right? And they got to go through all the things they got to do that Medicare tells us we have to do, right? So we got to ask about your colorectal screening and your mammogram if you're a woman, and are you wearing your seatbelt, and when was the last time you had a cigarette, and how much alcohol you're drinking. You got this whole laundry list that Medicare says we have to do, and then we say, and how are things going? And the gentleman or the wife with dementia goes, oh, fine, I'm doing great. And the loved one's going, they need some time to speak and talk and say, he sees ducks in the bathroom at night. Like, is this normal, right? And they don't get that opportunity to do that. And so very often primary cares are fooled. I like to use the word more like they don't have the time to really dig deep enough into it to really see, is there something that's going on? Because many people in stage 4 can pass themselves off as, perfectly fine. They know the day, they know the date. If, a lot of times they'll give me the retired speech. I'm retired, I don't need to know what day of the week it is. Really? Everybody needs to know what day of the week it is. Or, I haven't written a check out in a long time, so I don't know the date, right? They always have an excuse, a deflection for why they don't know. And so that's why, a skilled person, and obviously the family members will tell you, yeah, something's not right, right? They don't necessarily know what it is that's not right. They just know something's not right. What do you mean? Mm-hmm. You don't have doctor's appointments that you've made? You don't have to go to work, but you have to go to the doctors, you have to pay bills, you have to know when your mortgage is due, right? I mean, I agree with you. Like, even myself, I get up in the morning and I have to look at the date. Right. This is very true. My father used to say the only way he knew it was Sunday was because the paper was thicker, right? Right. But I agree with you. And I do think that that is true. But I'm talking about the person when you really press them, when you really say to them, well, what month are we in? You should know what month we're in, whether you're working or not. Or the other thing I get from patients a lot of times, they'll ask them what month it is, and they'll say, here or where I lived in, Connecticut. Okay, well, the seasons are the seasons, whether or not, yes, it's warm in Florida all the time, but you should know the season. You should know the year. And people will deflect on those things. Maybe the day of the week, maybe the actual date. You have to look at your cell phone. I agree. Yes, we do. We do for the date, but not for the month and the year. And a lot of times that's where they'll say, oh, I don't need to know that information. So a good point. Well taken. All right. Stage 5. So now we're really sort of getting into the moderate to severe dementia. And what I want you to do is I want you to look at these women's faces. And they all have sort of a look of absence, sort of a look of concern, sort of a little bit of anxiety, like, I don't really know what's going on. The other thing they have is a term that we use in psychiatry called poverty of thought. There's not a lot going on in there. There's not a lot of thought going on in there because there's not a lot of brain tissue left at this stage. They're not having complex thoughts that they're thinking about. They're basically trying to get through the day. And this is where the term sundowning comes from. The term sundowning really has to do with how much reserve we have when we wake up in the morning, right? We go to sleep, we hopefully get a restful night of sleep, we wake up in the morning and we have reserve, cognitive reserve. And throughout the day, we have to use that cognitive reserve. And it's like a little time, like a little hourglass, right? And it's dripping throughout the day. And everybody's hourglass is different, right? And maybe it's a day where I'm doing routine things. I'm at home, I'm going to get up, I'm going to fix my bed, I'm going to make my breakfast. And I rely on rote and routine and structure because that's easy for me. I don't have to use my cognitive ability to do anything, right? I can just follow these things along because I know this is what I do every day. But then my wife comes in and says, we have a doctor's appointment. Okay, so now we're going to drive someplace and I'm out of my element and somebody talks to me and I don't know what they're asking me and I'm anxious and my reserve is going down faster. I get home that afternoon and I'm like a wound up doll. I can't calm myself. I'm wandering around. I have motor restlessness. My wife says, do you want dinner? And I bark at her because I don't understand why she's asking me that. And we name this sundowning because it happens in the later day. It has nothing to do with the sun going down. It has to do with how much reserve we have left in terms of our cognition. Some people can make it all the way to 6 o'clock. And some people by noon, they're already starting to show these signs of agitation because depending on how much cognitive ability they have left, and it's different for different days. Like, did she sleep well last night? Well, she laid next to me all night, so I think she slept, but maybe she was awake thinking about things, and so she gets up and her reserve is even lower today, right? Or maybe she's in pain. Maybe she's, has something else going on that she's uncomfortable, and that's really, she's having a hard time processing how to even tell me that she's uncomfortable, and so she's irritable. So these are all of the things that happen in stage 5. In stage 5 dementia, we feel pain differently, we process hunger differently, our temperature is always lower, we always feel cold because of changes in our brain and our ability to mediate our temperature. And yet I don't know how to say that. I know I'm cold, but I don't know the fix for being cold. I don't even know to tell you that I'm cold. I just know that I'm irritable because I'm cold. And this is where we get back to it becomes like caring for an infant or a child, where we have to look at their basic needs. Are their basic needs being met? Are they clean? Are they warm? Are they hungry? What is it that they might need that we need to recognize because they can't tell us those things anymore? This is stage 5. And this is a very, very difficult stage because oftentimes we're guessing and we're learning, right? And one night they sleep well and the next night they don't, and then they don't have a good day, and it spirals downward, and then it's very difficult. And what changes is that it changes every day. I tell people the only thing that's constant about dementia is that it's always changing. That I hear from families all the time, well, he's never done this before. Well, this is what's going to happen. Things are going to begin to change. And then they may go back to a couple of days where they're at their baseline, but then you see a new normal again as they continue to decline or they develop different behaviors. They ask a lot of questions repetitively because they can't hold on to that information. And that's where the anxiety really comes in, right? So, and this is where I tell families, this is, especially for my husbands and wives, are very, very difficult. We share information very judiciously, right? If you have a doctor's appointment at 3 o'clock on Tuesday, you don't tell your husband on Friday that we have a doctor's appointment on Tuesday. Because from Friday until Tuesday, he's going to ask you 15 times a day who he's going to see and what time he's going to see it, because he's anxious, so he's not going to remember that information. So we are judicious about the information that we give people in stage 5 because we don't want them to be anxious about that. Yet here I am standing here, as I was joking with John about, being married for 37 years. These are your spouses. These are people that you have been with your whole life, who you want to talk to about things. You want to tell them what's going on in your life and tell them about things that you have to look forward to, even good things. You don't want to tell them that the grandchildren are coming over because they're still going to ask that question, even though that's a positive thing, right? And that's a real big paradigm shift for my couples, because now you've lost your spouse, that person who was your best friend, the person who you could share that information with. But it only causes them anxiety. And when you realize that and you begin to make that change in your behavior, that you're actually doing this to make them more comfortable, then it becomes easier to do those things. They don't look physically ill at this stage, right? You can see they're older, they look a little confused, but they physically, they look, you take them to Publix and you walk around in the store, nobody knows that there's anything wrong with them, right? Even though at this stage they've lost about 3/4 of a pound of brain tissue, and a normal brain is about 3 pounds when we reach full adulthood. They begin to have the inability to process information, right? So I put my remote control down here, and then I go away and I come back and it's gone. And I might have thought, after I put it down, well, I better put it over here so it's safe, right? And then I walk away. But in my brain, what imprinted was I put my remote control right here. So I come back and my remote's not there. It couldn't possibly be that I moved the remote. You took it. And you moved it. Why did you do that? He didn't even know the remote was here. And I'm accusing him of taking it on him. Happens with children. You want my money. Happens with spouses. You drop me off at Town Square. I think you're out cheating on me all day long. Who were you with? Why weren't you here? They don't understand what's happening, and so their brain automatically goes to whatever is the easiest for them to understand. And so this is where a lot of the accusations come in and a lot of the paranoia and delusions come in. And the first thing we want to do when they come to you at Town Square, did you have a great day? And they're like, were you out cheating on me all day? The first thing you want to say is, no, I wasn't. You want to defend yourself. That's reorienting them, right? Now, there are times when we have to reorient, especially when there's, accusations of infidelity or stealing money. We want to reassure them. But we also have to do it carefully. We also have to basically, say, why would you think that? Why would you think that? Why would you think I was out with somebody else? Or, no, I was at the doctor's, or I had to go do blah, 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 blah. Let's go get a snack before we get in the car to head home. And we change the subject and we redirect, right? Or we validate the emotion. Oh, that must be a very troubling thought. I'm sorry to hear that you think that, but no, that didn't happen, right? Validate that they're upset about what you're talking about, but don't necessarily come at it head on, because then they're just going to argue with you. Of course you were, because you weren't here. I didn't see you all day, so that's where you must have been, right? And it's so hard not to want to defend yourself, but it's not going to necessarily make things better. Sometimes you just have to say, you know what, we're going to talk